I greet you all in the name of our Lord Jesus Christ. We thank God who has kept us alive from the time we met last Tuesday to date. It's been a pleasure having you following Church of Uganda Family TV. We don't take this for granted. And one thing we can say is that we appreciate you and we are proud of you. You are the reason we are here. Now, I welcome you to the Family Hour. Family Hour, empowering families one episode at a time. This is our Tuesday edition. With me, Edrine, Osteen, Mukalazi. Now, Tuesday is always family health. We are discussing health. And it's a pleasure to have you seated and excitedly waiting for today's discussion. Of course, we have walked a long journey from where we started from with the Palliative Care Association of Uganda. We've had quite a number of amazing guests. We had Dr. Orem Jackson, who is the Executive Director of Uganda Cancer Institute. We also had Dr. Mwanga Moses, who is the Assistant Commissioner in charge of Palliative Care and Hospice. We had Sarah Komgisha from Kawempe Home Care Services. We had Mark Mwesigye, who is the Executive Director of Palliative Care Association of Uganda. We also had Rose Chiwanuka-Musoke, who is the founder of PCAO, but also a palliative care specialist, and very many other people we have had on this podium. It's been a pleasure walking this journey with them of palliative care, and one thing I'm sure is that all these discussions on palliative care have not left you the same. Out of these discussions, many of us have realized that we all need palliative care. It might not be today, it might not be tomorrow, but what about what will happen the other day? So that is why we are grateful that PCAO has really come out to send out the awareness, this awareness campaign, and we believe you too are aware. Now, my brother who at one time said, how comes we don't know palliative care? We don't see these palliative care nurses in hospitals. You were also sorted, and I believe you've now started appreciating the service, but we are still continuing with the talk. Now, there is something very, very special. Of course, if you've been following the previous episodes, you realize that each time every speaker was winding up their discussion, they're at least mentioning about a conference, which is the 4th Uganda Conference on Cancer and Palliative Care. Now, many of us have questions. How do I join in? How can I be part of this conference? Is it for only the palliative care specialists and maybe the oncologists? All those questions are going to be answered in this show. With us is the one Joyce Zalwango, who is a capacity building officer, Palliative Care Association of Uganda. Joyce, you're most welcome to this show.
Thank you, Edwin. I'm excited to be here. It's
a pleasure having you today. I know you've been watching us from a distance. Now you're here.
Exactly. I really want to acknowledge and appreciate Family TV that has hosted the Uganda Cancer Institute and the Palliative Care Association of Uganda to create more awareness about cancer and palliative care.
Okay. This is amazing. And later on, we shall have Dr. Benjamin Mwesigye, who is a pharmacist, but also head of research, Uganda Cancer Institute. So he'll be joining in later. But for now, we are continuing with Joyce. So Joyce, how is PCAO generally? I think we pick it from there.
Yeah, we are doing well at the Palliative Care Association of Uganda, and we are working hard to execute a very big event, and that is the 4th Uganda Conference on Cancer and Palliative Care. It's Uganda, but more international and broader. Okay. So we are doing well, and not to forget, we're a membership organization. So Edwin, I really don't know if you really subscribe to be a member.
Actually, by the end of these sessions, I should be one, because I'm one of the people who have picked up the advocacy of palliative care.
Okay, that's interesting. So we are working towards executing a conference, and it will be at Speak Resort Munyonyo in Kampala, and it will be on the 14th and 15th of September 2023. We have a program ready, and this runs from 8 to 5:30. With a number of things happening. So my call at this point that I can say, even before I go into detail, is not anyone should miss this conference. You caught my attention when you mentioned someone was asking, where do we find the palliative care services? Where do we find the cancer services? So you realize such events help us to advocate, to learn, to teach. So everyone should be part of this.
Okay. There is something you started with, and you said you're busy preparing a very big event. Why do you call it big, in a sense?
Oh yeah, we call it big because like conferences host close to 350 to 400 guests or delegates. So it's a big event that brings together people around Uganda, and these include professionals from the field of palliative care and cancer care, but also looks at healthcare providers, policy makers. It looks at the business people. It looks at patients and caretakers, who are very key in this aspect, because we don't want to leave them out as we talk about their care. So it's a big event in that it involves a number of guests, a number of delegates to participate. It's organized by the Ministry of Health. We have Uganda Cancer Institute, which is a very big body, and as the Palliative Care Association of Uganda, we are the overall association that is mandated by the Ministry of Health to coordinate and provide leadership for palliative care civil society organizations. So it's really important to us. It attracts international delegates who contribute to our work, but also people interested in research. Yeah.
So when you talked about people being interested in research, now I look at a situation where we have people who are not, they're not palliative care specialists or nurses, and they're not oncologists. But before we answer that, before we get to that, Dr. Benjamin, you're most welcome this evening.
Thank you so much. I'm sorry for slightly getting late. There was so much thick traffic, but nevertheless I made it here. Thank you.
We are grateful that you've made it here, and we are grateful. I kindly greet our viewers as we continue with this
Good
discussion.
evening, viewers. It's an honor and pleasure to talk to you live on TV, Family TV, this evening. Thank you.
And when we talk about, you found her talking about the 4th Uganda Conference on Cancer and Palliative Care, but we are more interested in knowing about the history of this conference. How did it start? How has it been progressing? And what prompts you to have these conferences?
Well, we all have a common goal of looking after cancer patients, both the Uganda Cancer Institute and Palliative Care Association of Uganda.
Okay.
And we thought, like, since we have this mandate, all of us, we need to have a common goal. And one of our common goals is to showcase. And you can only showcase when you organize functions like conferences, because you invite people who either have similar activities like you or who want to know what you do. And so we came together as the two bodies with our EDs and thought, how do we put our heads together to showcase? As maybe Joyce may have said, that palliative care begins from the time of diagnosis until someone passes on. And since for us we are much involved in care, if we partner with somebody who does the palliation alongside care, that combination makes a very good way of looking after patients suffering, not only with cancer, but all other chronic illnesses. It's therefore important that we mind ourselves on what we do, how we do it, but also invite our colleagues who have been there before us. As she must have mentioned, we have people coming from other international forums. Those people are very, very key in this conference, and they will be also appreciating or showing us where they have come from to where they are going. So this together makes a big force for us as UCI, but also as palliative care.
Okay, this is so interesting. Now, still about the history of these conferences, when we look at the progress, because I believe it's because the previous one was a success that you have the strength to organize another one. So when did you start, and where do you see the future of these conferences?
So the first conference was in 2017, and we decided that after that, the success of that conference of 2017 made us come up with a resolution that after every 2 years we should have a conference, because we would have done something to showcase, but also people would be able to take note of what we have, how far we have gone in the 2 years. So after that, 2019 there was another one, 2021 there was another one, and now 2023 they're going to be the fourth one.
Why do you organize them every after two years? Don't you leave a gap for the followers, for the audience that follows these conferences?
Not, we thought this the distance or the duration of 2 years would be okay for two reasons. One, financial implications. It is a big undertaking, and therefore needs a lot of budgeting, a lot of planning. I can tell you, I think from the time we started this, Joyce here, she has little time of herself. And yet we think we haven't done that much.
Yeah.
So you could imagine if it is annual, it will be back-breaking. So we thought giving it after 2 years would give us a good, not only things to show that we have done, but also budget. We plan properly, we get the budget, we get activities done, and then we achieve what we want to achieve. But also, since we have people coming from far, near and far, it is better for them to plan. It may not be easy to attract them every year, but maybe after 2 years, there will be a reason for them to visit. So the other thing is that, you know, in cancer care and in palliative care, certain things are slow. Like you may budget or may plan to do an activity, and the year ends before you accomplish it. But then if you don't accomplish it in 1 year, it's important to accomplish it in the second year. And because of that, therefore, it's a time frame that we think we can plan, we can organize, we can prepare, and have another conference.
Okay. Joyce, we now talk about the fourth conference of palliative care and cancer. And you had given us something about the preparations, but someone out there might really be asking themselves, because we've tagged it cancer and palliative care, and so each time you talk about such conferences, people think it is maybe doctors or scientists or palliative care specialists or palliative care givers that should attend the conference. Tell us about the attendance.
Oh, thank you so much, Edwin. Like I mentioned before, so this conference is not only for the oncologists, it's not only for the pharmacists like Dr. Benjamin, it's for everyone. If we can remember, during our first episodes, they were explaining what is cancer.
Yes.
And one of the people I remember mentioned that cancer can be curable in children, and cancer can be prevented. So it means if we center it to only doctors and nurses, we are leaving out the other audience, which is very key. So it brings on different people of different professionals. And when you look at cancer care, there is a lot of involvement. When you look at palliative care, it's a holistic approach that looks at physical, spiritual, psychosocial. So the reverends are part of this conference. Really, they should subscribe and pay and be part of this for the spirituality part of it, for care, the social. So this brings in more of the law and policy makers. We have problems that come up with disease. This is a life-threatening illness or serious related health suffering that involves will making, land things. So you find that this conference collects a number of people to join in it brings on students who are very key. So that is pre-service knowledge. Even before they come into place to work in hospitals, they have this knowledge. We don't forget the patients themselves and the caregivers. The more they come to be part of this, they share a real textbook example. They're the ones going through it. So it's important for them to come, and as the association as well as UCI, we learn a lot from them. You will hear Dr. Benjamin mentioning we've got cancer centers, but some of these things come as a result of this. What we get from people presenting, what are their challenges, sharing their experiences. And from that, we have resolutions on what to implement during the time frame before our next conferences.
Okay.
Yeah.
Dr. Benjamin, what are the expectations? I'm here, I've heard about this conference for more than a month. People are talking about this conference on cancer and palliative care. But what should someone expect?
There will be a lot of, as I said, knowledge exchange.
Okay.
You'll find people from near and far who will come and express how they have managed to combat cancer, to involve palliative care up to a community level. As I'm saying, conferences are times when we learn what people have done, and then we can copy from them. So there will be knowledge exchange, but also there will be experience exchange. There are a number of things that I've been doing at the UCI in the last 2 years. It will be the reason for UCI to showcase what do you have now that you didn't have 2 years ago. And that will educate the people who will attend. As Joyce has said, we expect everyone to attend, because it's not only the scientific papers that will be presented, there will be social papers to be presented, there will be holistic approach to cancer care. And therefore, everyone, whether a journalist, whether a policeman, whether a church leader, whether a businessman, is welcome to attend this conference, because there will be things to learn, experience to exchange, but also showcase really of how far we have come from, where we were 2 years ago and where we are today, and where we're going in the next 2 years. Just mentioned briefly about the cancer centers. They were not there during the other conference.
Not even one?
There was one which was starting, the one on Barara, but the one of Gulu wasn't there. So now we have one in Gulu. So if we showcase in Gulu, showcase in Barara, in the next conference, we should maybe show in Mbale, we shall Roa. So it's important that also people can appreciate the milestones that we make in caring for people.
Okay. Actually, when you talked about the cancer centers, I remember what Dr. Jackson shared with us and said, okay, he was talking about these cancer centers, and I think for purposes of elaboration, you can help us tell us what people should expect at the various cancer centers, for example, the one in Gulu and one in Bara, and those that are yet to come, and also what they should expect at the Uganda Cancer Institute. Is the other one a substitute or?
No, normally centers are built depending on capacity, but also on capacity of human resource, but also on equipment. For instance, the way we have set up Gulu is in such a way that it is so strong in areas of imaging and lab, and so we are thinking that the population in Gulu we shall be getting cancer at an early stage, because we have the facilities that can do early cancer detection. Maybe when we establish the one of Mbarara fully, it will be maybe for the children, but we shall get there when we see what is the capacity that we're putting there. The one of Mbale, maybe it may be for women. So these centers will not only help the people entirely for cancer and palliation, but also for specialty as well. We are establishing them as specialty centers, such that we can decongest the Cancer Institute. We are likely to think that Cancer Institute may remain only for highly specialized cases and maybe modalities that are newest in science for intervention to treat cancer at its best. We are not expecting to have like radiotherapy immediately in Gulu and in Barara, because it is a heavy investment. And so that may take some time. But as I said, that every year there is something that we build on. If we think that we have invested enough in the UCI, and therefore in Kampala, and therefore we need to expand our services to other regions, then we shall be able to think in that direction. But at the moment, services like radiotherapy will remain only at the center, whereas these imaging and other early detection modalities will remain at the peripheral or at the peripheral centers.
Okay. I think that is cleared. It really needed an elaboration, because someone may sit back and rejoice and say, wow, now that there is a center in Gulu, I don't need to go back to Kampala again.
Not entirely. You may come to Kampala for highly specialized treatment and other medical interventions.
Okay. Joyce, getting back to the conference now, because it is our main subject this evening. So, I have gone through the processes that we shall talk about later. So I've gone through the processes, I've registered. Now the conference time, is it a residential conference? Anyway, we start with is it a residential conference?
Okay, the conference is not it's not a residential conference, but there are provisions for someone who wants to sleep at the hotel, and that can be discussed between the hotel and the delegates.
Okay.
So there are accommodations that can be accessed for them to sleep, and even around the hotel. So if you go to our website, it is conference.pcauganda.org. We've put all that information on the website to ensure that our delegates are able to sort out where they want to sleep. So it's not residential, it's a 2 days of conference. People will come in, break off in the evening, and the evening of the first day we have a conference gala dinner. So the dinner is to be attended by all the conference registered and paid delegates. So I'll emphasize that, so that will take me to the issue of payment.
Actually, we are going to return with the issue of the payment.
Okay,
let us take a short commercial break. And when we return, we are going now to get the details of how we can be part of this conference, how you can register, and then the other negotiations of accommodation. Please stick with us. Welcome back from the commercial break. You are watching Family Hour Tuesday edition, where we discuss family health. Now, palliative care is a family health concern, because no one will really be happy if they're seeing their family member in pain. So that is why each of us needs palliative care. You and I are victims. So that is why we are discussing palliative care, and we've discussed palliative care this entire month together with the Palliative Care Association of Uganda. We've had very wonderful guests. Now today we are talking about the 4th Uganda Conference on Cancer and Palliative Care, and with us is Dr. Benjamin Mwesigye, who is a pharmacist but also head of research, Uganda Cancer Institute. And we also have Joyce Zalwango, who is the capacity building officer, Palliative Care Association of Uganda. We are discussing the conference. Joyce, before the break, I see you wanted to take us so much into the finances. So I didn't want to break you before you, because people really need to get this very well and very clearly, so that they don't accuse us afterwards. Now we have all the time to discuss the issue of payment and registration.
Okay, thank you so much. So about payments, we have registration fees to this conference. Okay. And really it's worthy it, because at the end of the day there is a lot to gain from this, as it will involve a number of showcases of work done in cancer and palliative care. Like we mentioned, it is an avenue for collaboration and networking with different people in the areas of academia. So it's very key. So we had a really fair fee of 500,000 for every Ugandan delegate who would want to participate or to come to the conference. And we also factored in that students really need something smaller than that, and that is 250,000 shillings for students. We have $150 for East African delegates and $300 for international delegates. That does not close the opportunity for people who don't fall in any of the categories. We have exhibitions, and these are at $1,000. So any person who would want to showcase their products, showcase their services, there is an opportunity that the conference provides avenues or provisions for them to showcase different things for the 400 target population or delegate number that we expect to have them have a look at that. And if you were PCAO member, the exhibition fee is $300. So that is an opportunity, and that was granted to us by UCI, our co-hosts to this conference, so that they are able to exhibit their products and services. And we also, in this, it's important to know that sponsoring such events is key. So we've also reached out to people, and again, I amplify the voice of the conference to say we still welcome sponsors to partner with us in doing this work. And we have the Platinum sponsorship package that is $10,000. And it comes with a number of things, but I'll only mention one, that this also allows you to have 10 delegates attend the conference. We have a golden package, and that is $8,000, and it gives you an opportunity to have 7 people attend the conference. And we have the silver, which is $5,000. It gives an opportunity to only 4 people. And lastly, we have the bronze, that is $1,500. It gives an opportunity to 2 people to attend the conference. So even people who are in business but really have a heart to ensure that we have prevention in a country, we have health promotion, we have innovation, because those are the tracks where we are going to be showcasing different work in such tracks. So if you really say we can promote health in our country, it doesn't mean we have to have cervical cancer numbers rising. So how will we promote health? Such avenues and events like our conference helps us to know from UCI they have really done a good work in prevention, where we say primarily health care. So they will showcase such work, which will be something to copy by other people from across the country, but also beyond Uganda. So everyone can be part of this. And as Edwin, you can say you're sponsoring 2 people to attend. We have 2 people. Yeah, we have people coming from hard to reach, and people like from Moroto, they are health workers, they are providing palliative care in Karamoja region. So them coming to attend such a conference will help them to improve their knowledge more in cancer care and palliative care. So once they are sponsored, it's such a great opportunity to reach down to someone at community level.
So just maybe for clarity, you've talked about the various sponsors, the golden, the platinum, the silver, bronze. So does it mean that when they come in to sponsor with whichever package they come, they don't pay the registration fee?
So they don't pay the registration fee. For example, if you're a platinum sponsor and you give $10,000, yes, it means you have an opportunity for 10 people to come.
Enter free of charge.
Yes, and because that package comes with that. It comes with a lot of other things. We'll have your logo onto our promotional materials. You will have your some time during the conference to talk about your products and services, and also you're contributing to a noble cause. Yeah. Okay.
And I think that is now clear. So, Dr. Benjamin, we look at conferences with themes. Every conference comes with a theme, and what is now the theme of focus for this particular one?
So, yes, you're right. All our conferences have been having different themes, and so we thought with all our teams together, what would be the best theme for this one? And as I said in our discussion, that we are looking at access to service. So we thought if we could use that as a theme, accessibility, quality, and then not only accessibility and quality, but but also, you see, it can be available, but people don't take it in. And so we make sure that we're looking at people having the service close to them, but also take it in. So we are looking at both cancer services and palliative care services being equitably distributed, accessible to all the population, but of high quality that meets the needs of both cancer and palliative care. So that is the theme for this conference. And all other sub themes in the conference will tailor towards that theme.
Okay. Wow, this is interesting. Now, Joyce, having gone through the theme, there is something we actually talked about before we brought in the finances, and we said on arrival on the 14th, I come at 8 or maybe before. I enter through, speak. What happens then? What happens when I enter? Of course, I know maybe the hotel staff might direct me where the conference is, but what happens then?
Okay, so what happens then? So we will have our team ready to receive all our delegates, and like I mentioned, it's a conference where everyone will pay. So we have a delegates list, and we'll have name tags for our guests. We'll have an opening ceremony, and our... So
in other words, when you pay, your name goes directly?
Automatically, we will have your name, we'll have your email, so we will also get back to you to say, is this the right name you want on your name tag, as well as the certificate that will be issued at the end of the conference.
Okay.
Yes. So, and from that, you will have support from the team around the conference to navigate you through. We have a conference program, and maybe to mention, our chief guest is the Minister of Health of the Republic of Uganda. So we'll have a very good opening ceremony with a number of plenaries happening. And during the course of the day, we will have abstract presentations. This will be oral and poster presentations. Abstract simply to mean the summarized work of different people that they are doing in cancer and palliative care. We'll have workshops, and like everyone has mentioned, we'll have workshops that are working towards improving cancer care and palliative care. One of the workshops is on access to medicines. So Dr. Benjamin has mentioned the theme as scaling up quality, accessibility, availability. So we want to look at medicines for cancer and palliative care in our country, Uganda. Where are we? Where do we want to be? When he mentions that we have cancer centers, meaning we are moving a mile, where people only were coming to Kampala, but now they can access a few things in the cancer centers. So that access to medicines, we want to know where is the gap, what can we do better, and what do we have, because at least we have something. The other workshop is looking at data, and that is palliative care data as well as cancer data. So we'll have people talking about what are the advances in the country. For example, we celebrate one where now, this year, 2022, the Ministry of Health is able to get or collect data in the Health Management Information System in regards to palliative care. That has not been there in our 30 years of palliative care. So such a workshop will strategize on what's the way forward, what can we do better on this, and if we have this data, how does it inform our country? We have a side event, and this is for sustainable governance, and it's looking at CEOs and board chairs. How can we, in this changing kind of donor world, how are we going to sustain to ensure that hospices are not collapsing, but they are there to reach out to the people? We have a workshop on research. Research is very key because it informs all the decisions. If we are going to go to the policy makers, we need research. We have another plenary on education and innovation, policy and law. Recently, the Parliament of Uganda passed a bill, is it a bill, is it an act? On anti-narcotics, which is very key to us in palliative care as well as cancer, especially at the area of pain management. We work with a medicine called all liquid morphine, which is a narcotic and needs special considerations and follow-ups. So in such an area, we had to see the bill before it was passed, the act before it was passed, so we had to submit our input, and so you don't run away from them. All those discussions is what will be happening, and they are very key and important. So it makes the day busy, but with a lot of learning, a lot of networking and collaboration.
This is now very serious. So, Dr. Benjamin,
yes.
You know, Ugandans, we Ugandans are really funny. Sometimes we respond depending on who. So, who are some of the guests, the guest speakers that we expect on this day, or on the 2 days conference?
There are very many guests, as Joyce had mentioned, very many speakers, including the minister will give a keynote address, WHO representative will give a keynote address, academicians, top academicians will give keynote addresses in the area of specialty, people in innovation, through the Ministry of Innovation and Science and Technology will give a keynote speeches at that occasion. And as you say, there are many tracks and each track we identified. I may not preempt all the names here because it will demoralize some people. True. But like each track will have a keynote person, and we tried to choose people who are really involved deeply in some of the things, and so it's important that people come and see what we have done, and as we showcase for different tracks and different activities on that day. And there will be 2 days, the first day, Thursday and Friday. They will all fall back to back, but with different activities that are involved, because we spread them all over for 2 complete days to make sure that we get value for the money involved in preparation of such a conference. Remember, this in Speak Rosette Munyonyo. It's one of the best places you can hold such a conference, and so we expect that people, when they come there and we are sharing knowledge and experience, it will attract the audience, and the audience will appreciate value for money that we put in this conference.
Okay. So besides the presentations and the keynote addresses, are there any practical activities that are expected? Yeah,
and this is from the exhibitors really. One of the exhibitors mentioned to me that he wants to demonstrate one of the mobile theaters, and I was fascinated when I looked at the demonstration. It's very important that people involved in surgeries in this country, the surgeons can come and see how does a mobile theater look like. That will make our case easy, that when you have an accident on Masaka Road, you can have this mobile theater, and the surgery is done there in a very clean and sterile environment. And so those are some of the few modern medicines, latest molecules that will be shown there, new technologies will be demonstrated there. So it's important that people come and see what is at hand, both in the public but also in the line of care.
Okay. Now there is something very important that Joyce had started on before we went for the break, and that was the conference gala dinner. Kindly tell us about this conference gala dinner.
Okay, so we have a conference gala dinner. And this event is a social event from a day's learning and exchange of knowledge. So it's networking time, and it will start at 6 and end at 9 p.m. So we'll have different guests at the gala dinner, and it's meal time, it's networking, it's sharing, it's giving awards to different people doing great work in our country. We have the founder of Hospice Africa Uganda, that's Dr. Anne Merriman, such important people who have contributed to pain relief in our country and saving people, helping them to improve their quality of lives. It's important. We'll have recognitions from people who have served at UCI, that have really done great to ensure that patients are cared for. So that dinner, we have a theme. It's the dress code. we'll have African touch
African touch.
for the dress code, and yeah, I don't know if Benja has
It's
more to say
not
about
that
that. Yeah.
Okay, African touch as in chitengi.
Yeah, so we'll have Bitengi
Bitengi,
for
yes.
that night, and yeah, we'll have a good time. So we welcome people to join in, and for example, sure about that, if you want more information on how you can be part of the dinner but you are not part of the conference, you can call our toll-free line.
Okay.
And that's it. Can I give it out?
Please do.
Yeah,
Please
thank
do.
you so much. So you can call our toll-free line. It is 0800-399-100 or 0800-399-100. So you can call that toll-free line for more details on how you can attend the dinner if you don't want to attend the conference.
So I'm getting something. I thought it was compulsory that whoever attends the conference can attend the dinner. Is supposed to attend the dinner.
Oh yeah. So if you have a delegate that has paid the fees we've talked about, the 500, the 300, the $150, you're eligible to be part of the dinner. But then there are people who will say, I am so busy, I can't be part of the conference, but I want to come to the dinner and in that way to contribute to the cause. So we also had to plan for such people. Yes.
Okay, that is cool. Now you know, I know people here who will be driven by food. But putting that aside, we front the benefits of this social gathering, the dinner, than the food. But within the course of the day, you didn't talk about the meals. Are they part all you mind about your lunch and breakfast? This money is for only the conference.
UCI and PCAO really take a good, they are so good at caring for their guests or delegates. So we have really a very good plan for our delegates. So we'll have teas, we'll have break teas at the time as per the program. We'll have our lunch as the time as per the program. So if you pay your 500,000 shillings, it encompasses your lunch, it has your break teas, it has your dinner, it has your abstract book, it has a number of things. We work with member organizations that will put in material. UCI will put in more material for us to learn on how to prevent, how do we access. So really, it's a lot, it's a big package, it's a full package. I will use that what is used so much today. So we really have a full package for our guests.
Okay.
Yes.
Dr. Benjamin, as we wind up this discussion, what are your words of encouragement to the people who are watching us right now? And as you add on your voice to invite them to be part of this conference.
I would invite everyone who's watching us to come and attend this conference, because it's not only a conference for people who are involved in taking care of the patients as doctors or nurses or palliative care specialists, but also as well-wishers for cancer and palliative care. But also, more importantly, to this conference, I want to mention, now that I have the opportunity, that all Ugandans, I encourage all Ugandans to always seek early cancer detection, because then we can get a cure. Coming late to hospital to seek healthcare means that the cost of looking after that patient is high, but also the objectives of treatment may change from really getting cure to palliating and good end of life. So it's important that we look after ourselves well, we eat well, we rest, we have enough rest, and make sure that we seek screening as one of our values, core values as human beings. We should always go to hospital and screen for cancer, because that's the only way we can get it early. And once we get it early, we're going to get a cure.
Okay. Thank you so much, Dr. Benjamin. Joyce, there is something you have not talked about. Now, as we wind up this discussion, kindly tell people how they should register for the conference? We've not talked about that. We've talked about the fees and everything, but we didn't tell them how they register.
Okay, thank you so much. So registration is done online, and like I said, it's through our conference website, and that is conference.pcauganda.org. But I will still re-echo and say, if you have challenges, please call the toll-free line, and we will support you to see that you register. We have our promotional materials. You can go to the Uganda Cancer Institute website. You will find a detail about the conference. You go to the PCAO website, you will find a detail about the conference. All those websites will lead you on how you register for this conference. So all registration is done online, but if you're failing, please call the toll-free line for support.
We'll repeat the toll-free line, 0800-399-100, 0800-399-100. Can we give them the WhatsApp number as well? Can other people use WhatsApp?
Yeah, some people can use WhatsApp. I don't have that offhand.
I have it.
But Edrine has it.
It is 0789-737-7786. 0789-737-7786. You can use that number for WhatsApp. The first one, 0700-399-100, is a toll-free line. You don't need airtime to call. Just call. Only working hours.
No, it's 24/7 for now.
24/7
Yeah.
for now. Okay. So even
and
if
you will
call
speak
now,
to me.
okay.
Yes.
No, they cannot speak to you because you're here.
Yes.
Yeah, until when he gets out of here.
Joyce, what are your closing remarks as we wind up this
Yes,
discussion?
I would like to say thank you so much, our dear viewers, for giving us your time to listen to us. We are very appreciative of your time set for us, and we want to acknowledge all the partners, member organizations, and sponsors that have really worked towards having our conference. They are working with us. Partners like Family TV, we can't thank you enough for all that you have done to ensure that this noble cause goes so wide. I call upon the media, different media houses, that this is something very important. We are seeing non-communicable diseases on the rise, but such forums help to see that we save our patients, to prevent, promote health, and ensure that there is early detection, treatment, and rehabilitation. I'd like to say, send my greetings to all palliative care providers out there. They're doing a great work to save and ensure quality of life of patients.
Okay. I think it would be a disservice if I don't let Dr. Benjamin send out greetings.
My regards to all cancer care providers in both Mbarara and Gulu centers, but also for those who are at the UCI Main Center. You are doing a tremendous job, and may God abundantly bless you.
And God bless you so much, especially you who do the cancer care and the palliative care. May God surely bless you so much. And everyone else out there who are doing the palliative care, the cancer care, you are really a hero. God bless you so much. And to you who has been following us from the time we started to now, you are also a hero. We love you so much, and we pray that you take this message because it is rich filled, and will you respond to the cause. Let us all be part of this conference. If you can, please be part of this conference, and I believe you'll be enriched, and you'll not be the same again after the conference. Edrine Osteen Mukalazi is my name. I've worked with Brinko Ategeka on camera, Ditmas in transmission, Jonah Jal, the producer. God bless you. We meet again tomorrow with Family, Finance, and Wealth.